Hey, Dr. Tyler Williams with Better Sleep SLC. Thanks for checking out this video. You're here because you have some questions on a dental sleep appliance and how long it will last, how long they're good for, when you need to be thinking about a replacement, regular wear and tear, how that compares to a CPAP or an Inspire implant or surgery. So to start off, generally speaking, with an oral appliance, you should receive some type of warranty with it. And if you have some questions specifically on warranty options and how those work, you can reach out to our office. You may call or text us. Contact info is below. Be happy to go through that with you or sit down with a consultation and see if an oral appliance is right for you. But generally speaking, when you start out, surgery far and wide is going to cost the most for most people. Sometimes anywhere from 5 to 10 times as much as a CPAP or an oral appliance. Now, when you go down to those two, oral appliance versus CPAP, which one costs more? So year one, year two, the oral appliance costs more. Generally speaking, that's because it's fully customized to only your mouth. So there's some upfront costs with the oral appliance. But year two and year three, the maintenance is incredibly low on those. You can do all or most of it by yourself. About year three, the CPAP will cost more than your oral appliance because of the maintenance and wear and tear on the CPAP, replacing hoses, cleaning the unit, replacing parts, those kind of things. Oral appliances, generally, you don't have that. So that's kind of your category. Your implant or your surgery are going to be much higher cost. CPAP is going to be the lowest initially. Oral appliance is pretty close. By year three, the oral appliance will be less than your CPAP. Now, that doesn't mean that I'm saying that you should pick one over the other two simply because of the cost. This is just so that you're informed and you're aware of some of the differences that we commonly see. So if you have Medicare, for example, Medicare will usually cover an oral appliance. If you have different types of private party insurance Medicare companies that work with your Medicare plan, like United Health or Blue Cross or those kind of things, then that can be contingent upon your plan. But if you have the red, white, and blue Medicare card, they're almost always covered as long as you've had a proper home sleep test and diagnosis. So make sure you're working with a dental team that can get that for you, not just someone who can make you a mouth guard or a snore guard because you're not receiving the proper diagnosis. And you can get into some trouble, and Medicare is not going to cover it without a board-certified physician's letter of medical necessity saying that you have sleep apnea. That's critical for that part. Okay. Now, if you have these private party Medicare plans, some of them have restrictions where they do not cover it. So you want to check. But generally, like at our practice, we have low monthly payments or cash savings. So if your plan doesn't cover it, like it doesn't for many people, or you have a high deductible, then the cash option works better. Also, if you have regular insurance, TRICARE, medical insurance, same thing. Most of them will cover an oral appliance as long as there is proof of medical necessity showing that you have sleep apnea. If it's only snoring, then it's not going to be covered. But 95% of people in our office that we test also have sleep apnea, which works in your favor because then you can get an appliance covered, generally speaking, because we're treating the medical condition and the side effect benefit is the snoring is reduced in most cases and sometimes eliminated. So with Medicare, for example, they're going to require, if it's done properly, that your appliance is warranted for 5 years. So that sleep dental office needs to work with a lab. It's going to warranty your appliance for 5 years. So these are things you want to check into. I have patients with appliances that are over 10 years old and they're still working fine. I have patients who have broken appliances in the first year because of excessive teeth grinding and clenching. Now, over time, we've upgraded our appliances, so that doesn't happen very often, but once in a while it still does or something comes loose. So you just want to talk to your provider about that as you're getting involved in the sleep apnea treatment. And remember, of course, that the more you do at home for maintenance and following instructions and taking care of it, the more likely you're going to succeed. Of course, the things that you do to help you sleep better, like getting to bed on a regular schedule, eating right, will also enhance the outcome and effectiveness of your sleep appliance. So if you have some more questions on the differences between CPAP, oral appliance, Inspire, other types of surgery, please check out some of our other videos. Thanks for watching, and we'll catch you on the next one.